you understood the pathology and why first fascia. Even fascia was developed, tension and adhesion secondary, but fascia surrounding muscles and holding. It's extremely important. You will see more, you will practice. And this understanding and imagination, what you will do, you will see more importance. But I positive it's today you understand the importance. I saw your performances, confidence and comfort and passion to continuing to do this. It was, therefore, I know this is good. Simple. Now, what is the continued education? Continued education is prepare you to perform it on clients and very will be very good if you immediately will start marketing and addressing people, you know, who suffering from these disorders. Like you said, it would be good to bring somebody with fibromyalgia. I would take this challenge. Look, I would take this challenge. It's challenge because not always. Sometimes they're very depressed and it's hard in one treatment, you know, to get in. But I know for 100% I will do this challenge because when I would ask question, some positive changes would be experienced, would be reported. It's possible. All this stress measurement, a little reduction of pain because they can compare different parts of the body. Therefore, it's kind of easy challenge for me. Now, guys, you today prepare to start addressing fibromyalgia patients and you have to do it. Otherwise, what for you to continue education? This is the reason why you could and you knew the topic and you took continued education. You have this confidence. I saw how you perform. You have to get confidence. You know you cannot rush a fibromyalgia patient. This is the process. You shouldn't expect from one treatment results. It's a very important percent. But you can make big difference in maybe in frame of 5, not weeks and months to work. In frame of 5, 6 treatments will be a lot of light in the end of the tunnel and then you can do a lot. Less it's merrier. You have to remember, you have to do all, if you're feeling that could be flare-ups because of too much suction and all, skip it. Your intuition, you know, you have to trust it. Skip it, suction more on this or combine. I saw a lot of you doing boom, then this disconnect, okay, you continue. And then you connect it again and continue. This is the way, it's good strategy. And especially with fibromyalgia patient, this is great strategy to work with this. Confidence, yeah, you have, I saw at the time of performances, and again, because of you understood. You understood what is the fibromyalgia, why I made a statement, it's start on level of muscles and have to be treated on level of muscles. What I would recommend to contact rheumatologists. Don't try to teach, I work, my practice probably 90% based on doctors' referrals. Now, I start in this medical community, physical therapists that were tied to doctors, and this is how I established some name and they refer. I'll tell you, I have a lot of experience with doctors. Medical doctors hate when you're teaching them medicine, really. At the time, they want to be sure that you know what you're talking about, what you will do, they want. Therefore, I would write some simple letter, pretty short letter. Anyway, he will not read, or she, doctor's office manager first, who read. Introduce yourself, I am licensed and insured. You have to state it that you're insured. I'm licensed and insured, massage therapist. I took continuing education on how to address conditions such as fibromyalgia conditions. I feel very confident, something like this. To give confidence that I can make different in these cases. Practically, I study, you can say, I study from person who many years addressing it successfully. Yeah, don't use fibromyalgia. Then, if they will ask, you have to tell. Yeah, and I company, please try with me a few cases. Yeah, you have to contact guys support group of fibromyalgia support group. This is a lot, and if you will search a lot, go there to present, ask to present, and don't be shy. Take with a business card and briefly write half letter. What is fibromyalgia? This, and I know how to address this to release tension with fascia, and this start all in level of muscles. And briefly, you can from my article, what you heard from me, you understood what is it. Briefly, very gentle procedure. We're not pressing. I go. You will have a little bit fantasy to put into this letter with your hook and ask to present. To present. You have to be ready to that people to whom you present, maybe majority. I have a lot of experience to present to this support group. They're skeptic. Big majority. It's okay. It's okay. These people so suppressed and exhausted that this is okay. Don't take person. Never. I'll tell you, 20 years ago they were diagnosed as mental cases. They are not. And they are not. Yeah. No. Little by little. Sometime you can do demonstration on spot. Little bit. Somebody will tell. You can ask, for example, who have tension headaches. You can, and all what you learn on tension headaches you can do in sitting position. In sitting position. Like they spend 5, 6, 7 minutes and it will suppress. It will suppress the intensity of pain. You know, I did this. I do this when I present to medical doctors. They're sitting skeptic, and sometimes when the moment is right, I ask him model to come. You have to start practicing treating clients with fibromyalgia immediately after. Don't let it go there. Otherwise, discontinuation will be additional certificate. You have to start practicing it on people. And again, support groups and rheumatologists. In neighborhood, write, think about this. You have my email address. You can conduct this letter and send to me for opinion. Maybe I will give some advice. Not grammar, English grammar, but how to put it. Yeah? You have to market yourself as a people who trained how to help people with fibromyalgia. Now, never make claim that you can cure, because fibromyalgia, in the meantime, not curable. Not curable. Why? Because this, and especially because of hormone changes, this always will be attempt, due to hormone changes, to create a situation that muscles will start accumulating tension. But what we can do, and I'm from personal experience, I'll tell you, one of the first, my patient with fibromyalgia was a young lady, very successful lawyer in Hollywood, representing a lot of stars. Harvard graduated lawyer. I don't remember her age, something near 40. And she had to drop big practice. She developed fibromyalgia. She couldn't practice. She couldn't. When somebody in pain and depressed, she cannot manage even, yeah. And she was sitting in one of my presentations on fibromyalgia, and good. Look, what happened with her, the positive, the bottom line, from being absolutely crippled, disabled, little by little, in a short period of time, she come back. She's working right now. I treating her sometimes. She, in fear, it's not good. She have kind of fear. Even she telling me no, fear that it can come back. She rushing all the time to me. I'm happy to see her. I'm treating her. I do stress management. Yeah, she knows. I said to her, it's not curable, but it can be manageable. This is what you have to say. If fibromyalgia is results of hormone changes, and this is the main contributor to this, you see, if you will be able to do this biological balance, there's even hormone replacement that, then maybe you will sustain forever. It's have to be managed, and you can manage fibromyalgia to the point that symptoms will be so minor, they will start slipping, they can manage well their life and go back to the business. Look, she also appearing in court. No, she said to me, Boris, I'm here and there. I know it will be this, and I know you here I'm running. She little bit afraid if there's something like normal pain, muscular pain than other having. For her it's a little bit flashing. Okay, she running the same. You will give the opportunity to the patient when you will sustain results during 10-15 treatment. They will start exercise in water, very gentle exercise, very gentle exercise. Stretching should be in the beginning out of this, out, because it's very easy to activate. At the time of stretching, what is the stretching? Stretching, we want to activate Golgi organ. This is stretch receptors that they will shoot impulse for additional relaxation. But on the way of stretching, there are spindle receptors. And this spindle receptor, this is sensitivity of muscles. They're very sensitive. If little bit, even you will do slowly, it will be enough to activate them and will be protective as possible. Therefore, stretching, they recommend, every time doctors recommending stretching, not now, tell them. Will come time, all have to come down, so to sustain good results for month, but during these months, yes, exercise. And the best to do in pool, if they can move just in pool, different movements, slowly, it is extremely important. It will feel good results and will sustain results. Yeah. You can, after this seminar, and I tell you, I feel this, I know this, you can manage fibromyalgia cases. You know enough and equipped. I know, I saw how you perform it, and equipped very well to perform. Any questions? I know you have a lot of other questions on fibromyalgia questions. Please.
I just want to add that when you're talking about support groups, there is, for the Facebook people, there's a separate page just for fibromyalgia on Facebook. So if you want to look for local people and just kind of join the group and say, you know, hey, I'm working on fibromyalgia.
I trained how to address fibromyalgia condition. This is the best.
I do have a question. My sister-in-law has pretty much all the symptoms you talked about for fibromyalgia, but she's never been diagnosed for fibromyalgia. Can I still use her as a patient, like as if she did have that diagnosis?
Yes.
Because she's very, like everything, very similar symptoms of it.
Stop treating. And maybe you will prove that this is fibromyalgia.
Okay.
How you will prove it? She will get, because all what I told you is to address fibromyalgia, chronic inflammation. How, if she will try to work a little bit more, does it flare up? If she will do physical work a little bit more?
Yeah, everything. She's always in pain. Always in pain.
But it will pain sensation increase?
Yes.
Will. Most likely this is fibromyalgia.
Okay.
It looks if function reduced to little bit doing more, it's crippling you. You know, again, what you can adopt as a thinking that 20 years ago here in the United States of America, patient like your sister-in-law coming, they do blood tests, boom, no evidence of autoimmune disease. Symptoms like, no evidence, exclude. X-rays and others, so no evidence of arthritis, or rheumatoid arthritis also can show. It's very similar. Then she crazy. Give her antipsychotic and she crazy, psychiatric care. Therefore, you should look at this, she diagnosed or not diagnosed. You should look as a professional, okay. This is not our scope of practice. When somebody coming with skeletal muscular pain, like you put on the table. It's good case. Do this. It's clinical trial for you to support. Take twice a week, but real professional, give you heart. I know she will not pay you. Look, guys, in our occupation, no matter you working for a lot of money, for a little money, or no money, you see, if you decide to do treatment, don't spoil your gift. Because if this is like a poison. This less money, or this less important person, let me do this. Or you're putting this infection that will destroy, you will be not able to focus and to do real treatment. Yeah. Give her real treatment, 15 treatments.
Okay.
Real. Try on full body to go immediately with no suction. Yeah, if you will feel. Yeah, and twice a week, 15 treatments, and then put report. Do study case, put report. Tell what you did and how. Yeah. Yeah. This case presentation could be good to bring your sister-in-law to the groups, to the support groups. She will talk.
She is on a bunch of like medications, and she's a very depressed person. Like everything, like I said, and she's always in pain. She always feels like something's wrong, but every time she goes to the doctor, they can't find anything wrong with her.
And you all over the body pain, and they didn't put fibromyalgia.
No, that's why I was just like.
You know, this is like look. It sounds again. We're not trying, but sounds like you said, and symptoms, and spatially, if she worked a little bit more, and boom, and this is first sign that this is fibromyalgia. Okay, like I said, they could put it like a psychiatric disorders also, and not diagnosed, don't pay attention. And you see, this is skeletal muscular disorders, and this is your expertise to address, because you're mobilizing by means of massage soft tissue. Yeah. You're providing connective tissue, it's just good alternative. Again, you shall view cupping mobilization as a good alternative, much more powerful to connective tissue, such that not much expertise needed, only this understanding. What you're doing, why you have to do introductory, and that introductory is very powerful method, and this all. Yeah, just all these cases like this, address and how it read. And I'm positive, you have my email address, you can write, ask some advice, I'll give. Okay. I'll give advice, but you immediately, I mean, plan it. Plan with her. No excuses. Twice a week for, I don't know, 15 times this need. 7 minutes. 7 weeks. For 7 weeks, twice a week. Okay. No, this reading and stop. Treatment. After 5-6 treatments, she will start sleeping better.
Yeah, she doesn't sleep either.
Absolutely.
That's another thing.
She will start sleeping better, but really stay and give her 45-55 minutes treatment. For her, it's extremely important. For you as a practitioner, it will make you much better practitioners. You know.
Good experience.
Yeah, and this all of you. She have client already. All of you who will take real fibromyalgia client, fibromyalgia client, like she explained, start working, and you will see in a frame of 5, 7, 8, 9, 10 treatments, big difference. They will start sleeping, and during 2 weeks, starting sleeping, because at night time, this is when it's real healing process. You're stimulating healing process, and this is going on process this time, it's night time. When they're not sleeping, very difficult to heal. Very difficult to heal.
I have a question. So those 50 minutes that you're talking, she should be doing 50 minutes. Should she be working just on the back with the cupping, or just the full body?
Guys, this is the question, the judgment up to you. And judgment should be accordingly to condition. I feel with her sister-in-law, she can try to go on full body. It's relatives, and this is really psychological. If they coming to you, they don't believe, and they're depressed, because they're relatives, it will be much easier to break this psychological barrier. Sometimes if you will see somebody sit like this, and very, like I said, very difficult to go a little bit, acupressure do, and then on back, and stretch it, try with no cupping, maybe legs, with cupping, with no suction you can do buttocks. With suction exclude on buttocks, exclude, because it's too dangerous, the chance is huge to aggravate it. Yeah, and just go, your judgment, to go on full body or to start on the neck and acupressure, your judgment. Will be good if you will be able to convince them. Most of them can be convinced. I gave you a very difficult case of fibromyalgia when they're coming like very, very suppressed, depressed, and this. Then you have to little by little take them out of this. Like acupressure, a little bit more energy, boom, this will raise. Whoa, it could be different. That's how mine will work. And start on back. After pressing on back, you can put them on neck, on side, a little bit on neck, to do face and touch. Meantime, you will see, when you will feel and you will see when to go to the next step. A lot of your judgment. Of course, ideal with her, I feel it will go immediately on full body. Immediately to go on full body, and maybe be careful with suction, but maybe from very first treatment you do this balm suction and go combination. It's too much. Boom, leave it. Go with no, like you did on her neck. I saw it today. Oh no, you did on her neck. Yeah, like this. Yeah, but you know it will be on your end. Very big mistake if tomorrow you will not sit with her. You will do schedule, timing, when, and this one. And don't schedule nothing on this time when you will perform on her. And it's not, oh, we'll see, I'll tell you when I will be able. It will not work. You have to do schedule,
Right away.
and let's rock and roll it. And really, 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 let's rock and roll it. And will be results. I have a feeling it is fibromyalgia, will be results. Will be. More questions, guys? No questions? Okay. What I know you have different questions you have on pregnancy. Who asked me on pregnancy? You said, yeah.